Good evening, everybody. This is me down in the little corner. My name is Professor April Demito, and I am going to be your professor for the next 8 weeks as you begin your journey towards advanced practice. You are going to begin nursing 673 on Monday, the 23rd. And I'm going to be teaching two sections. So I'm going to be teaching for cohort 163 and cohort 164. Something I'd like you to be mindful of if at any time you need to communicate with me, and I encourage you to communicate with me, make sure that you put your course and your course cohort down. Because as a full time faculty member of Olivet Nazarene University, I'm teaching at least 5 classes at a time. So I need to know exactly who is asking me the question. After a while, I get to know who's who, and it becomes a little easier for me. Um, since this is your very first class as you're moving towards advanced practice, I thought it would be a good idea for me to do an orientation of sorts for you, let you know a little bit about me, and let you know a little bit about what the expectations are for the upcoming 8 weeks. So, my name is April Demito. I have been a professor at Olivet Nazarene University for about 6 or 7 years. I can't recall now. I've been full time faculty here since July of last year, and I have taught many of the courses, including roles, pathophysiology 1 and 2, advanced health assessment, adult health, pediatrics, and women's health. So I'm pretty knowledgeable of the coursework. I love to teach. That is one of my greatest joys. And I love to work as a practicing nurse practitioner. So I work as a family nurse practitioner for a medical group in the Chicagoland area. I work in an acute care setting in the retail clinics. They're called the Advocate Clinics in Walgreens. And the Advocate Medical Group is the largest medical group in the state of Illinois. And it's been a wonderful experience working for them. I've worked as a nurse practitioner for the past 10 years. Previous to that, I was in OB. So I worked as a labor and delivery nurse, and then I became the unit educator, and I ended up becoming the director of the unit. And I did that. I worked in OB for 18 years. While I was getting my master's degree as a nurse practitioner, I was asked to step in as the nursing director, and I did. And it was a wonderful experience, and I did it for 5 years. However, after 5 years, it was time for me to move on and begin working as a nurse practitioner. So I left the only home I'd ever known in healthcare and moved on to become a nurse practitioner and haven't looked back. But I love teaching. I am 8 weeks away from finishing my doctorate degree so that I can focus more on teaching and make that more of my totally full time role as opposed to working in the clinic setting. However, I will never leave the clinic. I love it, but it'll give me an opportunity to focus a little bit more on teaching you all to be nurse practitioners. So let's look at the course, and I'll show you some of the things that I do as a professor. Now, one of the things I want you to be mindful of, many of you may have come through other Olivet courses, and that's a wonderful thing. You may be familiar with Canvas, which is the platform that Olivet uses for their coursework. It may be new to some of you, but every experience is a new one. So, as a professor, I may have different expectations of you than your other professors have. So, it's important for you to keep an open mind and not to think that the way things have always been done is the way it will be done in this course, because it won't be. I try to stay very interactive with students. I also expect a very high level of writing from students. So at this level, I expect you to have a command of APA format and know how to structure a paper. Now, I'll try to give you all the tools, but some excuses that will not be acceptable to me is this is the way that I've always done it. I'm an A student. I've always written this way in the past and gotten an A. Those excuses won't work for me. I expect a high level of graduate level work from you, and I will help to give you the tools that you need to get there if you don't have them already. So let's start right from the very beginning. This is what my page looks like with course resources, week 1, 2, 3, 4, 5, 6, 7, and 8. So, and then we have on this side the syllabus, the modules, grades, chat, people, and files. Okay. So I'm going to look at something right now for a minute. I'm going to look at people. So I'm in the 163 cohort. Oh, we've got a big class here. So we've got 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15 people in this cohort. So that's a rather large course, but not unmanageable. Okay, and then there's me. I'm going to go back to modules. Okay, and let's look at the syllabus first. All right, so here's our syllabus, and it was designed by Dr. Smith and Dr. Bruley. So I didn't have anything to do with the development of the coursework, but I have taught pathophysiology many times in my career, not only at Olivet, but at other universities as well. So let's look at our course outcomes here, and you'll see that the format uh, follows the same type of a format in all of the coursework that you do. You're always going to have the course outcomes. And over here, you'll see the weekly assignments and how they're broken up by weight. Now, something that Olivet does that not all universities do is that their assignments have a weight to them. And the problem with that is that you may have an assignment that's worth 200 points. Like your case study discussions will be worth 200 points. Now, however, they carry a 30% weight, which is a pretty high weight. And you may have a midterm exam, which is 100 points, carries 20% weight. So you may, an introductory exam is 5% of your grade, so that's your practice exam. And the issue with this is you don't depend on your total points. So I have students say, but my points aren't adding up. And that's because there's a different weight associated with that particular assignment. So it's not a straight point. So some universities use a straight point system. So 1,000 points in this course, each assignment is worth a specific amount of points. There is no weight associated to in any assignments, but this university follows this concept. So if you're confused about that and you say, but I don't understand why my grade's not adding up, you added a point to this assignment, however, it didn't affect my grade at all, it's because of the weight. And I'll go through that with you. So let's look at this. The course outcomes. Integrate the genetic and biological principles underlying the development of human pathophysiology. So what we're looking for in pathophysiology is the disease process, how the disease process comes to be at a cellular level. We want to evaluate signs and symptoms, diagnostic data, and correlate them with pathological manifestations of commonly found health issues. Now, this is a big transition for a lot of nurses because you are now transitioning from the role of the bedside nurse to the role of the provider. No more nursing diagnoses. You're going to be focused on an actual medical diagnosis of these patients. Translate current evidence related to the risk, etiology, and pathophysiology of selected health issues for individuals and populations. Apply clinical practice guidelines. which targets selected health issues to a plan of care. Demonstrate knowledge of pathophysiological alterations in assessment, diagnostics, and physiologic responses to illness. Critique published scholarly sources to effectively support one's writings. Create scholarly work using APA writing style and collaborate effectively with peers. So, collaboration is a big piece of the coursework that you're going to be doing. We do a lot of discussion group work, and I'll go into that as we get to it. The textbook that you're going to use is this pathophysiology book, and you should have an APA source as well. Now, a big emphasis of the coursework is this um, method of video case studies, and um, this was new to me last term, and I think it's fascinating. It's a database of case studies um, that have actual patients. Um, and I think that you'll enjoy it. It'll take you a week or so to get used to the format, but you'll get it, and I think you'll find it very helpful. The case studies consist of videos related to actual patient specific conditions to encourage a connection between underlying pathophysiology and their clinical manifestation in patients. Students will have access to 6 cases per 2 week cycle, but they are only assigned 2 cases per 2 week cycle to complete. So you're going to be put in groups, and each group is going to be responsible for 2 cases every 2 weeks. For the first 4 weeks, students work individually to complete the 2 assigned cases for the first and second 2 week cycle. So we're going to look at the appendix here. For the last 4 weeks, each entire group will work collaboratively and in depth with 2 assigned cases completed over 2 weeks in the discussion forum's third and fourth 2 week cycle. So the the beginning of the coursework, you're going to be doing this individually. And this is so you can get a handle on things. So for the first 4 weeks or the 2 case cycles, you're going to be doing this by yourself, alone, without working in a group setting. Okay? Specific segments of information for each case will be released at specific intervals during the 2 week cycles to allow students to think through the diagnostic and treatment process of the cases, as well as a final feedback posting to someone from a different group than your own, then a response posting to answer to someone's feedback to you. Also, during the last 4 weeks, this information is released in the same way to allow for a synchronous discussion amongst group members of various stages in the diagnostic process. Discussion will occur within group postings, except for the final feedback posting, which is done individually to a group other than your own, and an individual response posting, which is in answer to someone else's feedback posting to your group. This is really important. You're going to be sent an invitation. It'll look like the screenshot below, okay, to sign up for Real DX. Look for this email approximately 2 weeks before starting your course, so you should have it there already. And if you don't, you are going to have to advise or contact your academic advisor because they will need to resend it to you. It's only good for a limited amount of time. Once you click the complete profile button, you'll be prompted to enter your name, create a password, and pay $59 for access. This is a once a year payment. When done, you'll only have access to the cases in your assigned course. When you complete your profile in the steps above, you automatically receive a second welcome message with this link. So if you haven't gotten this, it's important for you to reach out to your academic advisor tomorrow so that you can access it. You might want to look through your spam and junk mail file first just to make sure that it didn't get put in there because sometimes it does. That's where mine was when I first started. Mm, excuse me. You'll be able to sign in at this URL each week. When you sign in to RealDX with your Olivet email, after having created your profile, you will need to do the following. Sign in with your Olivet mail and chosen password. Choose Olivet Nazarene University. Choose your course. And you'll be able to see the cases within this course. All the videos will be available to you from the beginning of the course. However, the drawers will be disabled. So they are only opened at specific times during the week. And we'll get to that in a moment. In the case search box at the top left, you'll put the case number of the two cases your group has been assigned for the current week. Put these in individually. Remember, you'll be able to see the video, but only the drawers that have been opened for you. In the discussion forum, you'll find your assigned case studies based on your group's assignment each week. However, for the first 4 weeks, you will complete the case studies individually. You will complete the case studies according to your group's assigned case studies, but you will do the initial postings yourself. But for the last 4 weeks, you'll be able to work in groups. After you have completed a 2-week cycle with individual or group postings, you'll be able to see all the completely opened cases assigned to all the groups for the 2-week cycle. Remember to review every person or group's postings to familiarize yourself with all 6 video case studies for each 2-week cycle, 2 per each of the 3 groups. And contact support at RealDX for any technical assistance that you may have. Now, the drawers are opened, not by me. Dr. Bruley opens the drawers when they need to be opened. But there have been some snafus. Dr. Bruley had an illness during one course, and she was having surgery. And so there was a time when it wasn't open. Let me know, and I will get in touch with the people, the powers that be, and get it fixed. Sometimes when you're at the piece where you're doing your differential diagnosis and you're trying to open the differential diagnosis drawer, there may not be anything to see. And that's because I have found that not all cases have a differential diagnosis that's provided by the provider by RealDX. So if that happens and you look and you see, my differential diagnosis drawer didn't open, it's because there isn't one. If you feel, if you're concerned about it and you want me to double check, send me an email and I'll check it out for you. Now, let's look at study guides next. A written study guide is provided for student review and support in Canvas files. This weekly study guide covers the concepts from this course for a given week. Completion of study guides is not required but highly recommended. It's going to help you a great deal on exams. And we have some recommended materials here for you as well, and supplemental materials. The MSN handbook. Now let's look at the MSN handbook or late policy. Late work is very discouraged. I don't like late assignments, and you'll see that over the next few days, your assignments will be popping up on the course calendar. If something comes up and you have to submit an assignment late, 10% deduction per day will be removed from your assignment grade. After the 3rd day, the assignment grade is 0. So really make sure that your assignments are on time. Let's take a look at the grading. All right. So this should be pretty appropriate to all of your other coursework where the grading scale is. All right. And then we have our course summary here. Now, I think what I'm going to do now is go through the modules. Okay, that's what we're going to do now. Now, I am going to be putting you all in groups, and so that'll come up. I'll let you know. You know what I think I'm going to do too? I've done this before with some success. I'm going to open up the groups and let you all choose the group that you want to be in. There are going to be 3 groups. I like it when you stay in the same group for all 8 weeks. And what I also do, if you're going to be in my Patho 2 course, I strongly encourage you to stay in the same group through Patho 2. I didn't always feel that way, but through experience, I have found that it takes a while for a group to get to know each other and see how everybody works together. And I found it beneficial. Now, what I want everybody to be a group leader throughout these weeks. So every time there's a group, you're going to need to assign a group leader, and it can't be the same person. You need to, everybody has to take a turn being the group leader. And the responsibility of the group leader is a big one because it's to ensure that everybody in in that group is participating completely. If you're not completely participating, it's not fair for you to get full credit for that assignment. These are big point assignments. So the group leader, it's their responsibility to ensure everybody's participating, to put the document together, and to post that document on the discussion board. It's also the group leader's responsibility to contact me and let me know, hey, you know what? Sally Smith really did not contribute at all. And then let me deal with it. There are other things that you do to let me know group members' participation, and we'll go through that when we get to modules. Okay. Now, I haven't put anything in the instructor bio yet, but I will. The very best way to get in touch with me is through email. And remember, when you're doing an email, I want you to put your course and your cohort number. So you can say, hi, this is Sally from course 673163. Or you can say, this is Sally from Patho 1, cohort 163. So that lets me know what course you're in. And then you can let me know what's going on. I'm a whiz with my smartphone. And when I'm in clinic, I'm looking at it between patients. So honestly, that's the best way to get in touch with me. I don't want people to use questions for the instructor. In fact, I blot it out because it's not easy for instructors to see questions that you post there. So I don't think it's a really good method to get in touch with me. Also, prayer requests. You can put those prayer requests here, or you can contact me and I'll get them in for you personally. Okay? This is a site that I really strongly encourage you all to look at, APA format resources. And in this particular section, it sends you to the Benner Library APA resource page. Let's go there and see what's there. Oh, my favorite, Purdue OWL. I love the Purdue OWL um, resource. Uh, you can find this study guide to electronic resources. You can find how to document just about anything on this page. So make sure that you're utilizing it because I watch for those things very closely. All right. So let's go back to modules. Now me, I use for my doctorate program, I actually purchased an APA format program, um, Perla. There's also another one that I use sometimes. It's called Reference Point. And those programs are really good to help you with your paper. But the one thing that I have to tell you is do not become complacent and think that those programs are making your references perfect because they don't. I know because I've been caught that way. All right, now examity. Now, the first thing I encourage you to do once you get access to your coursework is to get signed up to take your tests. That's the one block I have seen in this course is getting signed up for your courses. Do the sign up for as many of them, both of them, your midterm and your final, as soon as you possibly can. So let's go into Examity, course ID. So you're going to sign up for Examity. Okay. And we use two different methods. We use ExamSoft for doing our tests. So you need to go through these directions. A big thing that you need to do is make sure that your computer has a camera, that it has a microphone, and that your web browser is up. When we first started doing this 16 weeks ago, half of the class couldn't take their exam because they had not done this prior. So you want to make sure that you have all of the hardware that you need to be able to access your exam. The big thing is signing up for your exams in a timely manner. There are only so many time slots. So if you wait to the last minute, you may not be able to take it in a time that you wanted to. And there is very little flexibility for changing dates. So unless you have a pre-planned vacation that you planned a year ago and you're in a wedding standing up, or you have a terrible event occur in your life, your exams are not rescheduled. So getting those signed up as soon as you possibly can so that you can make sure that you are going to be available to take them, that you're not working, that you don't have an important family event taking place is incredibly important. So you need to do that as soon as you can at all take it. You've got to do it. Okay. All right. All right. Let's go back to modules here. Okay. Now, another thing I want to mention too, you're going to see announcements. Every Sunday, I make an announcement, and it's much like this. And in that announcement, I go over what the expectations are going to be for the week. Other things you'll see in announcements are I am going to teach you the basics of how to write a SOAP note. You're not documenting as a bedside nurse anymore, you're documenting as a provider. So we need to teach you how to begin documenting as a provider. So you'll get some basics from me in this course. You won't learn everything because we're really focusing on a lot. And if I can stress anything, this course is very intensive. It's an enormous amount of work. If you're working full time and you have a, a family that you're caring for, it's going to be incredibly challenging. So I like to get that out in the open right from the very beginning. This course is certainly not to be taken lightly. The exams are hard. The coursework is intensive. There's nothing easy about it. So you definitely are going to have to prepare yourself to that you're going to be working a lot on the computer in your office or wherever you do your work. And you definitely need to have the support of your family to gear towards success. That's probably the biggest piece of advice that I can give you. So let's look about a module 1, and we'll go through this so that you can get an idea of what we're going to be looking at. Module 1 overview. Okay. We always start our modules with a devotion. And I encourage you to go to the Reflecting God website. You'll find some very motivational scriptures on there. And it's important when you're struggling to know that you can get energized by looking at some scripture. All right. The objectives. Upon completion of this module, the learner will be able to analyze all key terms, apply key terms regarding immunity, infection, stress, create a therapeutic plan for a real-world situation related to immunity, identify scholarly sources, design a dynamic group strategy for your assigned group to develop effective evidence-based discussions related to the weekly video case studies pertaining to immunity and so forth. You've got a lot of reading to do. And in this course, I don't encourage anybody to make an effort to memorize the content. There's no way. This is incredibly complex uh, information. There's no way I would expect you to memorize it all. Reading it, absolutely. You need to read all of the chapters. This is not the course where you can say, I'm only going to listen to the lecture, because they're a very limited lecture. You have to read. And you've got a lot of chapters that you need to read. Another big piece, directions for taking proctored exams. This is required. You have to read through this. Okay? Course introduction video. And then here we get to the real DX cases. So this week, week 1 and 2, you've got individual case studies and discussion forum according to assigned groups 1, 2, and 3. So I'm going to open up. I'll do that over the next couple of days. You can see what group you're in, and the group you're in is going to dictate what video case you're looking at. Okay, so I'm going to open this up. All right. Groups 1, 2, and 3. All right, so here's the assignment. If you're in group 1, these are the case studies you're going to be doing, 504 and 391. Group 2, 761 and 121. Group 3, 801 and 385. This is a graded discussion and 100 points. It's 100 points a week. So you get 100 points this week and 100 points next week. So each assignment is essentially 200-point assignment. Okay. In this discussion forum, individual students will post diagnostic process for their 2 assigned video cases. The diagnostic process begins with gathering important information about the patient, both subjective and objective, starting the differential diagnosis process, and concludes with a prepared treatment plan. Okay? And this is the schedule. In the subject line of each post, indicate your video case study number and the stage of the diagnostic and treatment process for which you're submitting a post. So, on Monday, bright and early, the patient videos and assessment data will be available to be reviewed by students. The students will work to create a list of subjective and objective information relevant to their differential diagnosis with rationale for each diagnosis made. Each individual student posts a differential diagnosis including subjective and objective information from the patient video and the assessment data. Additional labs, diagnostic testing, if any, the student would order if this was his or her patient. A differential diagnosis with a rationale for each potential diagnosis is due Wednesday. So that's day 3, Wednesday at midnight. Week 1, day 3. That's when it's due. And all of your submissions will have time marks on them, so I know if they're going to be submitted in the correct time. Now, I expect that you will have 3 to 5 differential diagnoses for each case. That's my standard, 3 to 5. 5 is better than 3. All right, so now Thursday morning, bright and early, by 8:30 a.m., the healthcare provider's differential diagnosis will be revealed for each video. So you're going to see what the healthcare provider said has decided their differential video diagnosis is. And the point of this is to compare what you had come up with to what the provider came up with and discuss the discrepancies. The student will work to prepare a final diagnosis of the case, including the rationale for the diagnosis. And the diagnosis with rationale is due on Sunday at 11:59 Central Time. Now, on week 2, on Monday, the healthcare provider's diagnosis will be revealed for every video, and the student will then compare their diagnosis with that of the healthcare provider, considering discrepancies noted. The student will work to prepare a treatment plan connected to his or her final diagnosis, including based on cited clinical practice guidelines to include all medications. And any time that you are prescribing a medication, I expect it to be written out as though you are writing a prescription like a healthcare provider. And I'll correct you on that. So the first week or two, I don't want you to get too terribly uh, stressed. I expect everything to be turned in on time, but I generally work with students the first week or two so that you can have a greater understanding of what is the difference between subjective and objective. What is a differential diagnosis and how do I make one? In fact, I'm going to be um, giving you all a presentation I made on how to develop a differential diagnosis, and I think that you'll find it helpful. Also, I wanted to digress a little bit. Anytime you order labs or labs are being present, you need to also write what normal and abnormal lab results are. So you have to tell me what the ranges are too. It's not just enough to say that you want a CBC. I want you to tell me what the normals are for a CBC. It's very important. I don't think enough programs stress lab values, and it's incredibly important because you guys are becoming providers now. You're not going to be taking orders, you're going to be giving orders. Okay, Thursday, week 2. All video case studies for the week are going to be opened with all drawers information visible for viewing. The students will compare their treatment plans with that of healthcare professionals, considering discrepancies noted. Now, students are going to read other students' case study posts and review healthcare professionals' actual treatment plans for each case for the week. Students submit feedback postings to one other student's discussion forum thread regarding that student's treatment plan. So if you're in group 1, you're going to have to post on somebody in group 2 or 3. You need to have a reference and one scholarly article, clinical practice guideline, and or evidence-based guideline regarding the original treatment plan. Students will submit a response post to one individual feedback post. All right. In the subject line of each post, indicate your video case study number and the stage of the diagnostic and treatment process for which you're submitting a post. Individual postings should indicate which postings they are making. And there is a rubric here for you to help guide you. I love rubrics because they give you a really good understanding of how to develop your content. So take a minute to open up the rubric. And when I'm grading things, I use my rubrics. So when we move forward and we're getting to the paper piece, you need to have every piece of that rubric discussed. And it needs to be written in a legible manner, an understandable manner. And my computer is running so super slow. I don't know if I'm going to be able to pull it up. It's down here, I can see, but it hasn't opened completely. Okay. All right, we're going to move on. But definitely take a look at that rubric. Now, here, time estimation. This is important because I want to know how much time you're putting toward your assignments. So, submit your time estimation using the link for grading, and that's going to be done due at the end of week 2. Then we're going to start week 2, and week 2 is also an individual case study week, so you'll be doing this on an individual basis. Week 3 is also individual. Week 4, we're going to start the groups. So you'll know what group you're in because we're going to set those up ahead of time. And look at this. Oh my gosh, we come up with the midterm already. Ah, week 4 is our midterm. Now, I hold study sessions about 3 or 4 days before the midterm. The midterm's May 19th. So I'll have to look on my calendar and I'll determine when we're going to have that review. I strongly encourage you to attend that review. Reviews are not all inclusive of what the content is, but it gives you a good understanding of where you should be studying. All right. Week 5, your community disease portfolio. You have to get this started. Now, what does this mean, draft 1 and draft 2? Well, the paper isn't really due until week 6. What this allows you to submit it, to turn it in, and it allows you to have 2 opportunities to get your papers at a number that's low enough to not or not demonstrate plagiarism. And plagiarism is a big thing. I look very closely at it. I look more at your paper than I do at the number. Uh, In my opinion, any paper that is over 20% is a poorly written paper. And I want to talk a little bit about how to write a paper, but I think that we'll make that a separate video because this one's going long already and I want to stay focused on just the course content. Okay, now here's a way self-evaluation and peer group members evaluation during case studies. When you're doing your group case studies, this is a way that you're going to let me know how your group members participated in the group discussion. So I look at each and every one of those. And then we get to week 8. And week 8, we're going to do the final exam and a forum reflection. So this is, as you can see, a very full 8 weeks of content. I strongly encourage you to look at this website on a daily basis because it's not uncommon for me to um, have announcements to make on a daily basis. So I try to communicate a lot. You may say too much, but the one thing that I have learned through all of my experience working as a nurse, nursing director in management, as a nurse practitioner, communication is the most difficult um, expectation to meet because I may say something that I think is incredibly clear. However, I have how many students? 15 students are going to interpret my words differently. So I really try to make an effort to be clear, but I also understand clarity is subjective. So it is open to the interpretation of the observer. So I am looking forward to starting our journey together on Monday. And please, I'm going to be very busy over the next few days plotting out all of your coursework. And please, I'm sure that you have lots of worries and concerns, and let me know what they are, and I'll try to help you with them. If I find that I'm getting very similar questions, I'll post an announcement because if you have the question, I'm sure many of your course Your peers have that also. Remember, sending me an email is best. I generally will communicate with you within 2 hours. However, by Olivet standards, I don't have to get back to you for 48 hours. But I don't think that really ever happens. The only time it ever happens is if your email gets lost in 1,000 emails, which happens sometimes. If I have not responded to your email within 2 hours, please email me again. If I've not responded to that email again within another 2 hours, please text me and I'll have all that information out for you by the end of the weekend. I ask that you limit phone calls to emergencies because I'm often in the clinic seeing patients and I don't have the liberty to answer my phone when it rings. So, and I generally don't answer the phone if I don't recognize the number. So, text me. If it's an emergency and you really need to speak with me, it's almost best for you to send me a text and say, Professor Demito, can you please call me? This is Sally Smith from 673163. And as soon as I can, I'll get back to you. All right? I try to give you lots of resources to be successful, not only in this course, but in your upcoming career. And we'll work together and you'll get through. All right. I hope you have a good evening.